Please join in. We are starting. Hello, hello, hello. Please join in. We have started. Please join in. Please join in. We are starting. Chalo, okay. We are starting. Hello, bhai. Hello to everyone joining in. Please join in. Good evening to everyone. Yes, I am back. Yes. Yeah, I'll send you images. Don't worry. Okay. I had vada. Okay. Sambar vada. Okay. Class till 6:30. Okay. I have a flight to Chennai. So I'll finish cardiology. Okay. Nephro and GIT will do in next session. Okay, hematology will be a separate session. Dr. Pooja will take the hematology session. I will take a RR of hematology later. Okay, so don't worry, everything is going fine and you will do very well and you will rock. Yeah, live from Gautam Nagar. Long live Gautam Nagar. Gautam Nagar might be a very dirty area, very polluted area, very noisy area, but it is like heaven for FMGs. Why? Because the FMGs are all able to live, prosper, and succeed in this area. Okay, so yes, all the FMGs are here. They are very happy here. Yes, thank you, Dr. Revati. Okay, yes, welcome to most of you. Okay, yeah. So let's continue. Let's start. All of you for joining in. अभी करेंगे cardiology. So I want everyone to be fully attentive, fully focus, and yes, learn the concepts now. So what we are starting now? We are starting what now? Yes. So let's start now. Cardiology. Okay. So first I will discuss in cardiology. Pragati, okay, again, I will do these things in the end, okay? Because if you want, okay, look at this. Here the whole lobe is gone. If there's a entire lobe getting, this is called as lobar pneumonia. Here you can see dots, multiple small dots are there. This is called as your interstitial. This is your patchy both the sides. Can you see the opacities on both the sides? So this is called, these are opacities. Can you see that? So these are opacities in multiple area. This is called as your bronchopneumonia. Are you clear? So bilateral enlargements are your, yes, bronchopneumonia. Okay. So clear now? Okay. So let's come back. I'll start the cardiology. So ECG I will discuss first. In ECG, the most important thing which is asked is your rate and rhythm disorder. So first, you know the basic waves. So I will just tell you this P, Q, R. Okay, so this is P, this is R, S, also called as QRS complex. Sometimes you can see a Q wave also. And this is our ST segment. And this is T wave. Okay, this is the T wave. Basics you already know, I discussed in physiology also. Now understand, sabse pehla, what is normal heart rate? Normal heart rate is 60 to 100 per minute. So what is the normal heart rate? It is 60 to 100 per minute is the normal heart rate. Clear? So what is the normal heart rate? 60 to 100 per minute is the normal heart rate. Second question, the heart rate and all this, we use lead to use for rate and rhythm. So what is the lead we use for rate and the rhythm? The answer is rate and rhythm both are given the best by lead number 2. So which lead? Answer is lead number 2, best for rate and rhythm. Are you clear? Now what is the funda about the rate and rhythm? That is lead 2. So let's have a look. First is, remember what is rhythm is. So remember, if P wave is present, it is called as normal sinus rhythm. So P present, normal sinus rhythm. Okay. So if P wave is present, it is called as the normal sinus rhythm. And if RR interval is regular, constant, if RR is constant, then it is called as what? Regular rhythm. Okay, bachcha log. So what is sinus means? P wave is present. And what is RR interval constant means? It means the gap is not changing, is almost same. Okay, clear? It is almost same. That is called as your RR interval constant. Okay. Next important thing is, what is the, yes, here, if the rate is less than 60 is bradycardia. So how do you calculate? So heart rate is given by 1500 by RR in millimeter, by RR interval in millimeters. Clear? So it is RR interval in millimeters. So that is the funda. Done now? Now you can also take 300 by large boxes, but again, it's a faster method but not very accurate. So I prefer this. Sinus means assay node is making the rhythm. Make rhythm. The full form of assay is sinoatrial, that's why I call it sinus. Okay. So if assay node make the impulse, P wave comes and that means it is the pacemaker. Are you clear? Okay, Gagan. So is it clear to all of you? Is it clear now? Okay, done. Chalo. Next is what else do we also see? I'll show you ECG. You tell me. Let's say example. If there are 20 millimeter, that is 20 small boxes. What will be the heart rate? Tell me. What is the heart rate? Okay, tell me. All of you, calculate the heart rate. If there are 20 small boxes, what is the rate? Very good. Vaishnavi, Tanuj. Very good. Matilda. Very good. Belisa. क्या बात है? Margaret. Purnima. Margaret, sorry. Rishita. Ashwini. क्या बात है? Very good. Yes, it is 1500 by 20. इसको 150 by 2 भी कर सकते हो. It will give you 75. Very good. I am giving you a ECG. Yes, Piyush, you are right. Twinkle, Sultana, Harini, Preksha, Ashwini, क्या बात है? Only girls. Where are boys? Rishita, क्या बात है? सारी लड़कियों ने आंसर दिए. पीयूष, अच्छा पीयूष का आंसर आ गया. All of you should inside. Rajan, okay. Nayana, Vijay, Gaming Mafia, Bean, Rajdeep, yes. Riya, Arindam Jana, very good. Belisa, Nita, very good. Chalo, let me show you. I'm showing you ECG. You have to tell me it is rate and rhythm. So, question is, tell me rate, rhythm, everything. Rate, rhythm, everything. It will be on your screen in a second now. Heart rate and rhythm. Look at everything. How many boxes are there and what is the rate? Use lead number 2. So first tell me the heart rate, then tell me the rhythm. Let's count the boxes. Okay. Count. These are 5, 5. So 1, 2, 3. So 5 boxes. So each box is 1 mm. Calculate. हार्ट रेट ये कैसे आ गई? हाउ 150? 150 कैसे आ गई बच्चा? ठीक से करो. पहली बात, पी वेव इज प्रेजेंट. सो पी वेव इज प्रेजेंट, दैट मीन्स द रिदम इज साइनस. सो साइनस रिदम. RR is constant, not changing much. So RR is constant, that means it is regular rhythm. So it's not arrhythmia. Then next question, let's see heart rate. Count. 5, 5, 5, 5, 5. Again 5. So almost 25 boxes. So what is the value we will see? 1500 by 25. What is the value? 75 per minute or 60 per minute. 60. Very good. 60. So heart rate is 60. Okay, it's not bradycardia but very close to bradycardia. tachycardia. Very good. Congratulations. Okay. Now tell in this one what is the heart rate in this one. Again, it's a sinus rhythm, normal sinus rhythm. Tell me the heart rate. Just tell me heart rate. You are right. Perfectly right. Preksha, Harini, Margaret, Purnima, Vaishnavi, Rishika, Sabatina, Sultana, Twinkle, Ashwini. Very good. Preksha, Harini. Very good. Yes, Aditya, Mahi Chauhan. Very good. Yes, see, calculate. 5, 5, 5. This is 3. This is 2. So 20. Are you clear? So this is our 20. So that is the value is 20. Okay. So now let's come back. Okay. Now first is if heart rate less than 60 per minute, called as bradycardia, and if P wave present, sinus bradycardia. Treatment is we will use atropine, if not improve, adrenaline, if not working, then we are going to go for yes, our pacing by pacemaker, temporary or permanent pacemaker. So which pacemaker? Temporary or permanent pacemaker. So clear now? Next question. If more than 100 per minute, it is called as tachycardia. It is called as tachycardia. If more than 100, it is tachycardia. Okay. It is called as tachycardia. So what is tachycardia? It is more than 100. Now in tachycardia, what is the story? Remember, there are basically, if P is present, sinus tachycardia. Yeah, if you're taking large box, we can take 300 also. Tachycardia, ST. Treatment is we give beta blockers or CCB. Okay. And first we can try vagal maneuvers. Example, what vagal maneuvers? Example, carotid massage. Carotid massage or what else we can use? Okay. Or the patient if responding, ask them to do Valsalva maneuver. Okay, fine. Now, if P wave absent, it's either a VT or SVT, also called as PSVT. VT is obviously ventricular tachycardia and SVT is supraventricular tachycardia. Okay, so it is supraventricular tachycardia. Done. So it will be which tachycardia? Supraventricular tachycardia. Now, how do you know? Remember, here there is a wide QRS. More than 3 boxes. More than 3. And remember, 3 boxes means more than 0.12 second. Here there are slim या narrow QRS. Narrow QRS less than 3 boxes. Less than 3 boxes and a very regular rhythm. Very regular rhythm. Okay. Now what do you do? First is, remember, in this patient, if BP low, drugs are not used, use cardioversion. With synchronized DC shock. देखो, अगर बीपी कम है, ड्रग से कोई फायदा नहीं है. If BP low, don't give any drug. We do synchronize, yes, synchronize DC shock. What they look like? Look at this. So this is the story. Can you see? So are you clear? So this is the story here. Done. So you can see very slim and RR is constant. Let me give. So this is very slim, very slim. This is your narrow QR. So this become SVT. Here you will see mostly wide like this. Okay. So this make a diagnosis when you see the wides very wide, or so wide is the criteria, wide. You can also remember the shape is V shape. So V shape, victory shape is VT. Victory shape is VT. Okay. Now if BP is normal, that is patient is stable. So here drug of choice. If BP is stable, if BP, drug of choice is adenosine. And for prophylaxis, we can't use adenosine, short acting. We use verapamil, which is our CCB. Here the treatment drug of choice is amiodarone, or if not given, lignocaine. If not responding, we can again do cardioversion. Okay, else cardioversion. So what the rule is, if the person is not responding in both the scenario, the final and the last treatment become our cardioversion. So the last treatment, that is cardioversion. If not working, cardio. Here also, if not working, we can go for cardioversion. So the summary, if in arrhythmia, BP low, that is less than 90/60, or not responding to drugs, then do cardioversion. So is it clear to all of you? Then we will go for cardioversion. Are you clear? CPR is done in cardiac arrest. When the heart stops pumping, there is no blood coming, then we do CPR. Otherwise, it is not used. We use cardioversion. This is a arrhythmia. Rhythm is disturbed. It's not absent rhythm. It is disturbed rhythm. It is the disturbed rhythm. Are you clear, all of you? Now I am giving the yes. One more thing. If flat line, called as asystole, that is cardiac arrest. Then we don't use any current, no defib, no DC current. Treatment is CPR with adrenaline. Are you clear? Okay. Only use DC shock defibrillator if shockable rhythm, that is some electrical activity, like if shockable rhythm, like ventricular fibrillation. So shockable rhythm is fibrillation. Okay, so let's see VFib. What is VFib? VFib, the rate is very high. Very high, more than 350 per minute. So the waves are very close, 3 to 4 millimeter, irregular pattern, irregular intervals, can be close or apart, okay, and no waves identifiable, no waves identified properly, and it look like almost like a earthquake like this like this, okay, and this is called as VFib. Okay, this is the VFib. So remember, in VFib first, and also small size, okay, very small size, and the height is not big, okay, this is irregular. So if irregular activity, it's a hallmark is irregular, and there is no pulse and BP, no pulse, no blood pressure, patient has collapsed. That's why the question is whether to do CPR or this. The answer is it depends on the ECG. If ECG show this waveform, that means it is a fibrillation. We will shock it. So treatment is will shock it. So treatment is immediate defibrillation. Immediate defib. With desynchronize. See, cardio version use synchronize. Here we use desynchronize. High voltage DC shock. Energy could be 100 to 360 joules. Okay, followed by CPR and repeat. Repeat the shock, okay, depending on this, okay. So are you clear? So this is our whole story, okay. So immediate defib with desynchronized DC shock and CPR and repeat, CPR then repeat. Are you clear? So that is the soul story, whole soul story. Are you clear? So we will do, yes, desynchronized DC shock and our, yes, CPR, and then repeat. Then we will repeat. Clear? So are you clear here? Fine. So let's revise it. Then we'll move forward. And one more thing. If VT with changing amplitude, if there is a VT with changing amplitude, like up and down, like this. See, it's wide VR, is wide. So can you see it's wide QRS? So it look like a roller coaster ride. This is a roller coaster ride. Can you see roller coaster ride? So look like a roller coaster ride. This is called as tossets. Okay. So it's a VT with changing amplitude. Yes, it's a VT, but with changing amplitude. Here it is caused by, so it is due to class 1A and 3 anti-arrhythmic agents. So class 1 and 3 anti-arrhythmic agents cause the tossets. They cause the tossets. Okay. And yes, there's a QTC prolongation. That's why there is a wide QRS also. Okay. Yes. And also cat drug. Yes, you are right. Cisapride is also causing it. Okay. Amiodarone can cause it. Okay. Salotolol can also cause it. Also can by ibutylate. Okay. There's so many drugs which are causing itraconazole. So QTC. Drug of choice of TDC or TDP is magnesium sulfate. So don't ever forget. Drug of choice is MgSO4. So what is the drug of choice in this patient and in this case? Answer is, it is our which drug, which agent? Yes, it is our MgSO4. Are you clear? So MgSO4. Check. Let's start next. Okay. So I'll give a summary. Let's tell me what is the answer. Should I start? This, then this, 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 this. So given all the six, give me the answer. A, B, C, D. You can write A, B, C, D, E, F. Let's start the session, bacha log. Can you tell me what is A? What is A? Yes, A systole. Bhagyashri, you are right. FMG neurotoxic, Mad Vision. Chalo. Yes, Sultana, Purnima, Twinkle, Vaishnavi, Ashwini. Yes, you are right. Where other people answer? Yes, it is A systole. Yes, Tanuj, you're right. It's A systole. Yes, Amrita, very good. Margaret, very good. Margaret, very, very good. Then what is the second activity? Yes, Ashwini, you are right. Vaishnavi, Piyush, yes. Preksha, Ashwini, Tanuj, Purnima, क्या बात है? हरिणी, very good. भाग्यश्री, very good. Matilda, Nayana, Ria, Bellis, Medivision, Hitesh, very good. Very, very good. Okay. If I'm not take a name, sorry, Soumya, Tanuj, David, it is VFib. Okay. What is the third one? Third one, C. C. Yes, you are right. Sultana, Tanuj, Ashwini. Let's see. Preksha, Vaishnavi, Digvijay Singh. बिल्कुल सही है. B is VFib. I agree with you all. रूपाली, नयना, भाग्यश्री, संजय, प्रगति, रिया, भाग्यश्री, अरुण, गौरव, पूर्वांग, सौम्या, हितेश. Yes, it is VT. VTAC. It's VT. Very good. Very good. Yes, you're right, Hitesh. What is the answer of the fourth one? D. क्या बात है मार्गरेट? सबसे पहले yes. वैष्णवी, very good. Is TDP. Tossets. It's tossets. Very, very good. What are the E? Anyone? E. E is, yeah, roller coaster. Yes, you're right, Sultana. It's roller coaster. This is which one? E. F. What is E? Yes, SVT. Last one. Last one. Very good. You are all right. Very good. Mahi Chauhan, Gagan, Asima, Mohanty, Soumya. Very good. Very proud of you. Very, very good. Arman, thank you very much, Arman bhai. Congratulations, you pass. Do your PG and yes, we'll be very happy. Chalo. Yes, yes, you're right. Yes, it is SVT. What is this one? Last one. Flutter कहाँ है बच्चा? फ्लटर नहीं है. फ्लटर तो मैंने पढ़ाया भी नहीं आपको आज. देखो ना, P wave is there, T wave is there, P and T. So obviously it cannot be flutter. Flutter is sawtooth. Okay, it's not. It's not bigeminy also. It is sinus tachycardia. It could be normal, but I am making all the rapid now. They are all rapid. Sinus tachycardia. सही है. So sinus है. Sinus. Okay. अरे बाबा sinus है. ठीक है. Normal में इतना पास नहीं होता. They are very close. Can you see? They are very close. Sinus will be like this. Normal sinus. This is normal. Are you clear? So it's a tachycardia. It's a tachycardia. Chalo, it's my mistake, but again, it's a tachycardia. Chalo. So that's why always calculate. ठीक है. Gagan, actually the impulses are passing through normal conducting pathway. That's why they are narrow. In the VT, it's generated in the ventricle, so that's why they spread to whole ventricle, taking more time. That's why they are wide. So just remember, if they are coming via AV node, they will always be narrow. If they are coming directly from the ventricle, they will be wide. Okay, Gagan? That's why called as ventricular tachycardia. SVT is supraventricular, above the ventricle. Most commonly SA node. Okay. Very, very good. I am proud of all of you. Now I'll tell you the atrial flutter and this. So atrial flutter. In atrial flutter, you people will see. ना P दो बार P क्यों आएगा यार सेल सिकार्डिया में? There will be no 2P waves. There will be it like a normal ECG but at a faster rate. Okay, so that's why it's a normal ECG but at a faster rate. Okay, चलो. So flutter में क्या होगा? पहला इसमें होगा sawtooth. बिल्कुल सही बात है तनुज. Sawtooth. So what is seen here? Sawtooth pattern. Sawtooth. And there is 4:1 ratio with QRS. And there is a regular rhythm. Regular rhythm. And P is not seen, rather flutter is seen. And there is normal heart rate. Mostly normal heart rate. SA. QRS. So this is your atrial flutter. Okay, ठीक है. Just rate is different. Okay, in flutter the rate is 250 to 350. Fibrillation the rate is 350 plus. Okay, mainly it's the rate. Okay, fine. So this is your flutter. P wave is absent. Obviously they are replaced by yes P wave replaced by flutter waves. ओके बच्चा लोग देखो 4 है 1 2 3 4 ये फ्लटर वेव है और ये आर है. ठीक है. या दिल बी अगेन आई एम टेलिंग यू meningitis will be there. Okay, then this ECG will be there, all will be there. Okay, then come atrial fibrillation. The main feature is again P is absent and there is a irregularly the RR is not constant, RR is variable, and they will mention a word in patient. Patient has syncope palpitations and very high risk of thromboembolism. ठीक है, now I'm making it easy ना, why are you afraid now, I made it so easy for you now. Okay, and high risk of thromboembolism. That is why always give anticoagulants. Which one? वही warfarin if the patient can take orally, otherwise IV heparin. Warfarin or heparin. Okay. And the pulse is irregular pulse. Okay, so that is the main funda. Let me make it. Okay, can you see? So RR interval is changing. It is not constant. So this changing RR interval is the hallmark of AFib. Okay, is the hallmark of AFib. Am I clear now? So this is our AFib. Okay. Now treatment of A flutter, AFib, same. If BP low, that is patient is not stable. Again use cardioversion. Cardioversion, ठीक है, cardioversion. See, adrenaline is used if there's a arrest. If there's a arrest, we'll use adrenaline. Okay, here we are using cardioversion, and if stable, A B C D. A B C D. A is amiodarone. It is class 3. Also can use E-butylid, dofetilid. Some book rather say that they are better than amiodarone, but again, B for beta blocker, C for CCB, D for digoxin. Digoxin is preferred if there's a AFib with heart failure. Okay. So that is the treatment plan. These two are basically used for rate control. So if there's a tachycardia, we can use the beta blockers to bring the rate down. Otherwise, the main drug is amiodarone in this case also. Okay. So have you understood this? Let me show you the ECGs. So let's have a look at them. So can you tell me what are we going to see here? First question, look at this. Look at the main thing. P wave is not there. This is T wave. There is no P wave. P is absent. Heart rate. Before heart rate, we see what? There are 3 boxes. There are 2.5, 3.5, 2. RR is not fixed. RR is alternating. So this is you most likely, yeah, AFib. This is AFib. This is AFib, non-sinus rhythm, and the RR is variable, irregular. So most likely it is A absent plus tachycardia is not. This is not a tachycardia. Why? It can be tachycardia. Let's calculate. If you take 3, 3 will become 15. So that is 15 by, it can be a tachycardia. Why? Because it's close to 100. Very close to 100. So can be a tachycardia. So that's why the heart rate is very variable. Very, very variable. Okay. See, digoxin, I discussed that in pharma, Avdesh. Were you there? I said digoxin is basically, yes, safer in the case what? It can be used what? So remember, digitoxin is longer name, longer name. It is broken by liver, so it can be used in kidney disease. Whereas digoxin is broken by, removed by kidneys, oral, water soluble, short half-life. So that's why it can be removed by kidney. So not used in kidney disease, but used in liver disease. I discussed that, Avdesh. I was there in pharma class. You can check the pharma notes. I discussed very well each and everything. Okay. Lag is there? I don't think there's a lag. Kindly check if there's any lag. It was not from my side. Okay, my side is okay. Yeah, I discussed that very well. बस याद करना digitoxin is liver. Liver will remove it. So not used in liver disease. Digoxin is removed by kidney, not used in kidney disease. Okay, बस. Yeah, digitoxin is hepatic. बिल्कुल सही बोला. चलो, look at this ECG. What do you see here? Tell me the findings or diagnosis if possible. Give me. Yes, it is sawtooth. It is 4-wave, 4:1. So it is plus RR is constant, not changing much. So this is your classical A flutter. A flutter. Chal. I am removing everything here. You make a diagnosis. If you have seen it already, still try to make a diagnosis. Tell me the heart rate first, okay? You people, tell me the heart rate first. Heart rate. Can you tell me the heart rate? Answer. Yes, heart rate, you are right. See, how many boxes? 5 are here, 3, 2. There's almost 10. So almost 10. You can take 10 boxes. See, 5 and 5, 5 and 5, 5 and 5, 10. So 10 mm will give you a heart rate of 1500 by 10, that is 150. It's a tachycardia. Then, is P wave there? No P wave. See, there's no P wave, only T waves. Only T, no P. No P wave. No P, and the QRS is very slim. Can you see only 1 or 2 box? So 2 box. So there is narrow QRS. What did that become? Yes, it become SVT. So tachycardia, SVT. Then it is our SVT. Yes, you are all right. Very good. So it is a SVT. That's what I'm telling you. Okay, exam, these questions would be there. Should be able to solve. Look at this one and give your interpretation. This lead to, you can check lead to. First, tell me the heart rate in this one. Heart rate. Take from here to here. Calculate the RR. हार्ट रेट तो बताओ भाई तनुज पहले टेल मी द रेट डायग्नोसिस तो ऑब्वियसली वील ऑल कैलकुलेट टेल मी द रेट ऑल ऑफ यू चलो let's continue. Yes, it is around, see, calculate, it is around 1 2 3 almost 8. So you take 8, 1500 by 8, that give you almost what? 8 will give 4, it becomes 750 by 4, or it become 37. It's almost coming 180 per minute. Yeah, 188. So 180 is tachycardia, but it is normal, narrow or wide? It is wide, QRS. That's why it's a VT. It's a VT. What will be the treatment as per you? What do you think? What shall be the treatment? Tell me. Tell me. Let's continue. Okay. So treatment is amiodarone or lignocaine. If not responding, cardioversion. Yes. See, propranolol is not used in this case. We'll be using cardioversion if BP is low. Else we'll give lignocaine. This is VT. You can see the rate is very close, hardly 3 or 4 mm gap. So heart rate is very, very high. There is no wave identifiable, just earthquake-like activity. This is your ventricular fibrillation. Ventricular fibrillation. This is tossets. Can you see? Roller coaster. So look like a party streamer or roller coaster. Roller coaster. Done. This is your tossets. Treatment. What will you give treatment? Tell me the treatment. Bachcha log. Treatment. Yes, MgSO4. Yes. You all are passing the exam. You all are going to rock the exam. And I know these people are going to come and bring me sweets and chocolates. So after passing, what you are all going to do? So you all will pass. My best wishes. You all will pass because you are very good students attending the session till now. Yes. And you all will pass and you will get the result by 15th August. Yes, you bring sweets or bottle of something. Okay, bottle. Yes, very, very, very good. Okay, and in case you cannot come, you can do even Paytm or GPay. We'll buy the bottle and sweets. Okay, if you can't come, you can. Yes, you can even do Paytm. Are you clear? Yes. So all are welcome. Okay, please don't do 5 or 10 rupees. It looks very cheap. Okay, clear? इसमें तो कैडबरी क्लियर भी नहीं आती आजकल. ठीक है, so do some good amount ताकि अच्छा वाला सामान आ जाए. Good quality. Do you want us to have poor quality or good quality? Good quality ना. Bad quality is not good for liver. So good quality. Bad quality very damaging to liver. So that's why yes, बिल्कुल better quality material we want from this. Okay. बिल्कुल अक्षय आ जाइए मेरे भाई, गले मिलियो. यस, सो विल हग यू, विल यस गिव यू सर्टिफिकेट, ट्रॉफी एंड यस एनीथिंग. ओके, बट डोंट फॉरगेट. ओके, क्लियर? लास्ट टाइम आई गॉट 400 kg sweets, you know. 400 kg. That means almost people were coming, bringing. So I got 400 plus around 50 bottles, different varieties, 50 bottles. Okay. Yes, बिल्कुल, anything okay Margaret, anything okay, clear, anything from any place. Okay, chocolate, biscuit, juice, anything. Okay, बिल्कुल अक्षय मेरे भाई, ठीक है, 50 bottles. Okay, so I got 200 kg, so I have to give them. So I gave to Gautam Nagar people, staff, so I distributed. So I felt very bad. Why I felt bad? Because I could not eat them, clear, and I calculated 400 kg. Each box cost around 500 rupees. That is almost 2 lakh rupees. 2 lakh rupee. If they would have been in the shape of 2 lakh rupee, कितना अच्छा लगता, कितना मजा आता. 2 lakh rupee. This 2 lakh I can even go abroad. Clear? Let's say Russia, and drink, eat there, and I can eat or drink there. है कि नहीं? Maybe something else also. Okay, maybe went for some sightseeing tour, maybe some party, maybe beach. So that will be. Yeah, you can watch the rapid revision. Okay, and that is the main thing. Okay, Aman, yes, so that is the case. Okay, चलो शैम्पेन, क्या बात है, कुछ भी. या बिल्कुल दिल से बुरा लगता है भाई, बहुत बुरा लगा देख के 2 लाख रुपए का स्वीट बेचे हुए. चलो रशिया नहीं और कहाँ जाऊं बताओ. शुड आई गो टू विच एवर? अमेरिका तो बहुत कम है, इतने पैसों में अमेरिका नहीं जा सकते. नो अमेरिका, सो मे बी मॉलडीव्स, मे बी गोवा, ठीक है, मे बी जॉर्जिया, आर्मेनिया, या सो मेनी. ओके, so we can go any place. Okay, yeah, at the secret. Okay, so I'll tell where I go, maybe दुबई, ठीक है, चल, और सबसे बेस्ट गौतम नगर. ओके, गौतम नगर पार्टी to all the students. Okay, big party, 2 lakh में there'll be lots of. Okay, thank you अक्षय भाई. Okay, Thailand. Okay, why will I go to Thailand to drink and eat? I can eat and drink Thai food here. चलो आगे चलते हैं. Okay, so let's continue. Okay, yeah, we are enjoying. Okay, so let's continue. Okay, so you are happy na? So that's the main thing. Okay, I want all of you to be happy and just, yes, relax. Exam is there, but we are studying. Why should we take stress? Okay, always relax. Okay, now remember, if there is a bundle branch block, bundle branch block, are you clear? So yes, bundle branch block. Okay, what just we see is, first we'll see is wide and notch QRS. Notch QRS, बस याद करना, wide, it look like a M or W, M or W like this. If you see a M or W like shape, that is your bundle branch block. Just remember, it is your bundle branch. Okay, clear? So that is the case. Okay, so are you clear? So bundle branch block. Okay, so let's start now. Okay, so remember my logic. If you want to solve this question, very simple rule, just remember notching of the QRS. Okay, and mainly we will see two patterns. One is, if you see the M in V1, it is your RBBB, RBBB, like this. This is R dash S. Then if you see M in V6, it is LBBB. This is your case. Okay, so please remember, this is the only thing we need to remember for the exam. Are you clear? So this is your M or W pattern. Just remember this is more than sufficient. Okay. Then comes our AB block. Okay. In AB block, there is increase. There is increase PR interval more than 5 boxes or more than 0.20 second, because one box is 4.04. Okay, clear? Yes, you are right, Dr. Ashwa. It is also called as William Marrow mnemonic. Okay, yeah. Chalo. So clear now? So that is the concept. Okay, and remember, in first degree there is no dropping of the beat. First degree, no missing beats. P QRS is 1:1. That is called as first degree. That is called as first degree. Okay. Second degree, there is missing beats. That is QRS absent. QRS absent. Not all, some QRS. Some QRS absent. This is called as Mobitz block. Called as Mobitz. Is two type, Mobitz 1 and Mobitz 2. Okay. So remember, Mobitz 1 and Mobitz 2. Yes. In Mobitz 2, there is a regular drop. So P by QRS ratio become 2:1 or 3:1. So it become 2:1 or 3:1. So 2:1 or 3. Here what happens? There is a progressive lengthening of PR followed by yes dropping of QRS. Followed by dropping of QRS. Fine. Followed by dropping of the QRS. Okay. This is called as Wanky back phenomenon. So I'll make the graph. Look at this. 2 P wave, then QRS. 2 P wave, then QRS. 2 P wave, then QR. This is your your 2:1. That is this. Here, look at this. So what do you see here? See here QRS is absent. QRS. This is P wave. So let's label the P waves. P wave, P wave, P wave, P wave, P wave. And this is the QRS interval. So what do you see? There's an increased PR. Can you see that? So PR is increasing and here there is no. That is called as your Wanky back phenomena. Are you clear? So missing always or it is once. Once missing, then it is called as your Witt phenomena. It is called as your Mobitz 1. It is called as Mobitz 1. Okay. Now let me show you. So please have a look at this ECG. What do you see? First, in this case, count the number of boxes. First is count the number of boxes, calculate PR interval. Can you do that? What is PR interval? It is from P to QRS. Count the number. P wave तो है रेवती, कहाँ बच्चा हार्ट रेट नहीं निकालना, PR निकालने को बोल रहा हूँ बच्चा, ये P wave है. So P wave है और QRS भी है. Can you count? Okay, I'll count. 1 box, 2 box, 3 box, 4, 5, 6 पे आ रहा है. So 6 boxes. That is 0.24 second. Is it normal or increase? It is increase. So it's a AV block. It's a AV. But is there any dropping of the beat? No. No missing QRS. So it become what? It become first degree. It become first degree. So are you clear? So it will become our what degree? First degree. Okay. Okay. So first degree. Clear? Now, so it's like a husband comes home late, like he's coming 6 p.m. So he used to earlier come 4 or 5 p.m. Now it's coming 6. So it's coming late, but he comes home. So wife is upset, but not very upset. Now comes second degree. See, husband come 5 o'clock. How many box? 1, 2, 3, 4, 5. Husband come 5 o'clock. Then husband come 8 o'clock. So husband is coming more late. Husband come 10 p.m. Husband is coming at 10 p.m. So wife asks what? I am busy. Then one day husband is not home. So wife is waiting 5 o'clock, 10 o'clock, night 2 o'clock, morning. Next day when the husband come, wife will do dishum. क्या बोला? अगली बार लेट आया, बच के नहीं जाएगा तू, बच के नहीं जाएगा, बच और बैक. सो क्या हो गया? वैंके बैक. सो दिस इज योर वैंके बैक. ठीक है. और किस पे आ गया? 4 p.m. I am home. And then again 6 p.m. Again 6 p.m. क्यों? सुधरेगा थोड़ा ना, फिर से अपनी उस पे आएगा. ठीक है. That is the case. Okay. Understood? And here what happens? Husband is coming home once a night. So एक बार घर आता है, one night come home, other night doesn't come home. So always one beat is missing. So other night where does the husband go? So out of 2 P wave, there is P wave, okay, 2 P wave, but 1 QRS. That means there is 1 QRS missing. So one night he is not home. Where is he? Maybe night duty or maybe some other duty. So night duty he is doing. That's why it doesn't come home. Okay. So it doesn't come home. Okay. And if you do it for reverse, wife not coming home. So wife come home one night, other night doesn't come. Now does it look less or more offensive? Tell me, is it more offensive? Yeah, Savdhan India और क्या है वो? Crime Patrol. Okay. So it looks less or more offensive. Clear? Now it will be more offensive. Why? It hurts male ego. Like I am a boy, I am a male, I can come home, I have friend, so that's why males don't mind this. Okay. Yeah. But if female not coming is like, she has done some kind of big error, big guna, big paap. So that is the problem. Okay. There's high, what do you say? Hypocrisy. Okay. Gender bias is there. It's, you can say, also calls them, yes, sexism. If female is not coming home or even late, the husband will start scolding, fighting. Yes. Clear? Chalo. Okay. So is that clear now? Chalo. So clear now? So you know the story. Once there is a couple who have 3 kids. Okay. They have 3 kids, okay, and they want to take a divorce. But the problem is how to divide the kids, because there are 3 kids. So judge advise them, do one thing, get one more kid. Then you can divide 2 and 2. Okay, you can divide 2 and 2. Okay, so now they say, okay, so after 1 year they get a twin and they are 5 again. So what should the judge advise them? What should be the advice? Tell me. Chalo. Fake judge. Okay, advice is give one kid to judge. तू रख ले साले. Give one kid to judge. ठीक है, तुम्हें ही शौक था ना बच्चों का, लो तुम रखो एक बच्चा जज को. फिर से या जज शुड कीप वन किड. ओके, so one more story. Once there is a female, she is having 2 kids. Okay, she marry a boy or guy who's also having 2 kids. Okay, and they marry, and after marriage they have their own 2 more kids. They have 2 more kids, total 6 kids. Okay, so 2 are her own kids, 2 are the new husband kid. Okay, 2 are new, total 6 kids. So one day the wife called the husband, please come home, your kids and my kids are together beating our kids. समझ में आ गया? So my kids, your kids beating our kids. So again these kind of dramas are yes, okay, very irritating. Okay. सही है. So that is a very चल, let's continue. Okay, so I hope it's clear. In 3rd degree there is वाह क्या सीन है मोदी जी, क्या सीन है, वाह वाह. चलो नेक्स्ट क्वेश्चन. यहाँ पे स्टेप ब्रदर स्टेप सिस्टर है ना, ये सब क्या है, स्टेप ब्रदर स्टेप सिस्टर्स है ना, स्टेप ब्रो स्टेप सिस. कितना भयंकर वाला होगा ना. तेरे पापा मेरे पापा पर मेरे पापा तेरे पापा नहीं, तेरे पापा मेरे पापा अलग, तेरी मम्मी मेरी मम्मी मेरी मम्मी. सरदर्दी. ओके, क्लियर. एंड व्हेन दे ब्रिंग देयर सम फैमिली यूनियन टू मीट, तो दिस पर्सन ब्रिंग द ओल्ड वाइफ, शी ब्रिंग द ओल्ड हस्बैंड. वाह क्या रायता फैलता होगा. सो दिस विल बी एक्सट्रीम, यू नो, रायता सिचुएशन. ओके, ठीक है. चलो let's continue. Okay, yeah. Too much okay comedy. Okay, chalo let's continue. And if no relationship, 3rd degree. In 3rd degree divorce is like a divorce. ठीक है, so it is 3rd degree. Okay, yeah. My kid, your kids fighting our kids. Good na? Chal. Let's continue. Okay. Now we are having a look at the hyperkalemia. So just remember what happens in hyperkalemia. It is serum potassium more than 5 milliequivalent per liter. 5 is normal, 5.1 hyper. So what are the changes? First, there are tall T wave, tall peak T waves. Then there is increased PR interval. Then there is ST elevation. Sorry, no ST elevation, really sorry. Then there is also what is there? Yeah, ST elevation also there. Then there is arrhythmias. Sine wave could be asystole or even arrest. VFib, wide QRS, so many findings are there. Main is tall T wave and increase PR. Okay, tall T and increase PR. So that is the whole story. Okay, let me show you the ECG here. So have a look at this. This is your changes. So in mild, that is 5.5 to 6.5, there is peak T wave, prolonged PR interval. Then there is what? Wide QRS, ST elevation is there, ectopic beats can be there, sine wave is there, fibrillation, asystole, block, so many problems are there. So this is your yes. What changes? These are treatment. Treatment is basically we give calcium gluconate, MCQ. So treatment is calcium gluconate. So we'll give the calcium gluconate. Okay. Then also we give insulin and beta agonist. Beta 2 agonist. Which one? Salbutamol. Are you clear? So that is our salbutamol. Okay. And if not responding, we can do dialysis. Clear? So this is asked in the exam, management of hyperkalemia. Are you clear? So I explain you all the important ECG, and my good faith, you will remember them and solve the questions in the exam. So very, very important. Okay. So let's come back to our topic now. So I discussed the ECG already. Now we'll start with heart. So in the heart, there is basically three main vessels. One is the right coronary artery. It supplies the inferior wall of the heart. So which wall? Inferior wall, which mainly contain the right ventricle, and the leads are 2, 3 AVF. You can remember, like if someone failed the exam, the person feel inferior. So when do you feel inferior? Will you pass or fail? Obviously when you fail. So that's why a failure feel inferior to his friends. सही है? Even crying. ठीक है? He failed. Okay. And now he will give second or third attempt. So which attempt? Second or third. ठीक है? So if someone fail, they will give second or third attempt in this case. सही है? तो याद कर लो. What is inferior leads? They are 2, 3 and AVF. So 2, 3 AVF are inferior. ठीक है? Two, 3 AVF. Done. And which artery? Right coronary artery. Which wall? Inferior wall. बोलना नहीं है, बोलने का नहीं, क्योंकि एग्जाम में आएगा. अब आ गया हमारा राइट कॉर्नरी, हो गया लेफ्ट कॉर्नरी आर्टरी, 2 ब्रांचेस. और द 2 ब्रांचेस LAD and CX. CX is circumflex. It supply the left ventricle mainly, called as a lateral wall. And remember how many L we have. L means life. How many life we have? 1 life. So L and 1. Remember mnemonic. L1 is the mnemonic. L1. 1 life, 1 love, 1 lateral. So it is the lateral. So its lead is AVL and lead 1. So what are the leads? They are lead 1 and AVL, also V5 and V6. V5 and V6. Okay. So V5 and V6. Done. So clear now? Chalo. Now second is our LAD, LADA, which is left anterior descending artery, LADA. So LADA supply our anterior wall and the left ventricle. and they are basically V1 to V6. It is extensive anterior wall. Septal are V1, V2, anterior wall V3, V4, and lateral is V5, V6. So that's why we can have anteroseptal or anterolateral. So who will be anteroseptal? I'll just write here. So if it is V1 to V4, V1 to V4, it is anteroseptal. And if it is like V3 to V6, it's anterolateral. ठीक है, anterolateral. Done. Next question, right? The most common artery which is involved in our coronary artery disease is our LADA. What is LADA? Left anterior descending. That is why इसे कहते हैं widow's artery. Why? Because males are affected most commonly by coronary artery disease, which is caused by atherosclerosis, and atherosclerosis caused by poor unhealthy lifestyle. तो जिंदगी झंडवा फिर भी घमंडवा, वही जिंदगी झंडवा है. That is obesity, then no physical activity, alcohol, smoking, and poor, dietary habits, eating lots of carbs. Okay, so all this increase the risk of atherosclerosis, and this plus diabetes, this can cause narrowing. It's more common in male. Remember, autoimmune diseases were common in female, but lifestyle disorders like obesity, all this, hypertension, more common in males. So that's why LADA is widow's artery. LADA is widow's artery. So that is why it is yes. Next question. If there's a coronary artery disease, there will be ischemia. Ischemia causes chest pain called as angina, which cause increased sympathetic heart rate, BP, uneasiness, anxiety can be there. Plus classical sign is Levine sign. Patient is holding and is also radiating to left side, and pain radiate to left side. Pain radiate to left side, arm, shoulder. Arm and shoulder. Classical sign is our Levine sign. What is Levine sign for? Angina pectoris. There's a clenched fist over the chest. Clenched fist. Okay. Now there are two kind of angina. One is classical. Classical is pain occur on exertion or any emotion. Like example, when you are checking your results on the computer, what kind of angina you will have? Classical or variant? Variant occur at rest. Variant is rest. Remember, variant rest. Classical is exertion, activity. Yes. Also excitement or exercise. So ज्यादा ई करेगा तो टी हो जाएगा. तो ज्यादा ई कर रहा है तो ई से आ तक. So ज्यादा ई अच्छा नहीं होता. Yes. So when you're checking your result, it will be classical. Okay, it will be classical. And when you tell your parents your result, which angina can they have? If you tell the result, variant or this. So I'll just make you remember. So what angina? Let's say a student, FMG student, by chance they develop some disease. So let's say a FMG student or teacher. Let's say like I'm a FMG teacher. मेरा main hallmark ही क्या है? Yes, the IMGs think I am a FMG teacher, and FMG think कि yes, I am not a good PG teacher. That's why I am FMG teacher. तो मेरा तो क्या दोनों तरफ से ही कटना होता है. ठीक है, उधर जाते हैं तो कहते हैं अरे you FMG teacher go there. If I come to FMG, वो क्या बोलते हैं? Oh, only FMG. That means you are not a good NEET PG teacher. That's why it's like a love triangle. FMG run after NEET PG teachers. I, sir, run after FMGs. Okay, clear? But not NEET PG people come after me. It's not a triangle. Okay. So remember, FMG run after NEET PG teachers. NEET PG students run after IMGs. They don't give a damn about your people. Okay. So NEET PG teacher after IFMG, and Ashish sir is after this. So कहते हैं ना सबसे पीछे लाइन में हम खड़े हैं. So I am at the back. Okay, so मैं बिल्कुल एंड में खड़ा हूं. ठीक है, चलो. So question is, if FMG, let's say some FMG develop, yes, I'm telling you, okay, most FMG respect only NEET PG teachers. They respect. And अभी recently I heard कि sir why should we join NLC? our juniors are saying कि आशीष सर तो फ्री में दे ही देंगे, तो फिर NLC ज्वाइन क्यों करना? So that is what the feeling they have. It's good feeling कि at least they think कि I am available for free. पैसा सिर्फ देंगे बाकी टीचरों को, कोचिंग ज्वाइन करेंगे बाकी इंस्टीट्यूट्स की, लेकिन फ्री के लिए we can watch आशीष सर also. That is the case. Don't worry. I wish I was so rich. I don't have to work for anything. We can give all the free. Maybe one day that will also come where we have all subject, all coaching, UPSC, IES, NEET, GATE, सारी फ्री हो जाए. I can give all for free. I'll wait for that day where actually I can make them free. फिर देखता हूँ कौन कौन सा टीचर रह गया, ना कोई नीट पीजी ना कोई यूजी एफएमजी, all become the one. Okay, so NEET PG teachers. Okay, so FMG. So FMG get angina in Russia and in exam results. So what do you think will be the angina? अगर angina हो जाए रशिया में तो कौन सा होगा? वेरिएंट, क्लासिकल, रशिया या जो भी फॉरेन, कौन सा वाला होगा? एंजाइना रशिया. चलो, यस, ऑब्वियसली इफ इट इज रशिया और ये सब, इट इज योर वेरिएंट, क्योंकि आप वहां रेस्ट कर रहे हो ना, आराम कर रहे हो. तो अगर कोई आराम कर रहा है, चिल मार रहा है, वहां पे घूम रहा है फॉरेन में, सो दैट इज अ वेरिएंट. ओके, बिकॉज वहां इतना एक्सर्शन नहीं करते आप, पर अभी रिजल्ट है, डर गए, फियर, ये क्लासिकल. सो क्लासिकल कब होगा? जब आपका इमोशंस होंगे. वहां रशियंस को इमोशन तो होते नहीं है, ठीक है, प्लस दे आर सिटिंग होल डे, सो दैट्स व्हाई वहां कौन सा होगा? वेरिएंट. सो विच एंजाइना? वेरिएंट एंजाइना. विच एंजाइना? वेरिएंट एंजाइना. सो आर यू क्लियर? यस. नेक्स्ट क्वेश्चन. If pain is at rest, it is called as variant. Why? Prince don't work. So remember, prince always rest because they are prince. प्रिंस आराम करता है, ठीक है, प्रिंस आराम करता है, ठीक है. चल, what the treatment? Nitrates will give sublingual nitrates. Also will do CCB, but never beta blocker. Why? Because they can cause vasoconstriction. So that's why they can do yes. Next question. If the heart rate increase, it increase the oxygen demand. So this will cause what? Classical angina. This causes the classical angina. Pain is relief at rest. Okay, and the treatment is nitrates, aspirin, CCB, beta blocker. It is nitrates, aspirin, CCB, and what? Beta blockers. And the beta blockers. Okay, now come our stable angina. Stable angina. Okay, if pain is relieved within 10 to 15 minutes at rest, it is called a stable angina. Okay, stable angina. Here the screening test is stress test. What the test is? Stress test. Okay, we will ask the patient to take nitrates. Okay, take nitrates and come next day. In stable, we can give nitrate, aspirin, CCB, beta blocker, and if the pain is relieved, we ask him to come next day. Okay, and we will do stress test. What we'll do? Stress test. Either exercise stress test called as TMT, treadmill test, or we can do a drug stress test, that is dobutamine. So when you give dobutamine or when you do the exercise on the treadmill, it causes a increase in the heart rate. High heart rate causes high oxygen demand. Same way, beta 1 cause high heart rate, high demand will cause ischemia. So if I have a normal artery, no problem. If narrow artery, ischemia changes occur, and the change is ST depression. So can you see this? So this is ST, normal ST. So this is green, normal ST. This is normal. This is our normal ST. This is your depress. This is decrease ST. Are you clear? So this is, yeah. If the patient cannot do exercise, then to obviously we'll go for your yes. ST depression is there. Okay. Sure. Now once there is a ST depression of more than 1 mm for more than 80 milliseconds. So how much? 1 millimeter for more than 80 millisecond, 80 seconds, sorry, in 80 millisecond for 2 or more leads. It is called as your positive stress test. Or the scoring called as, it's called as Duke score. It is called as the Duke score. Very good, Duke score. Now, how do you confirm? So confirmation is via angiography. So what do you do next? Angiography. Angiography is the best. Why? Angiography will tell you the site, the percentage of the block, the number of stenosis, everything. So best investigation is which one? It is angiography. Okay, let me show you. So this is our, can you see narrowing, narrow lumen? This is our normal angiography. This is right coronary, this is circumflex, this is left anterior descending. So left anterior descending. Are you clear? So left anterior descending. Next question that we see, this is our what? Narrow lumen. So this is what lumen? Narrow lumen. If the lumen is narrow, see, ideally it should be like this. Can you see? Here there is normal lumen. Can you see that? So normal lumen. Can you see? Now this is narrowed. Can you see? Very thin opening is there. Can you see? So you can imagine how less blood would be going. So that's why it indicate a stenosis. Okay. Which one? In the LAD. In the LAD. Okay. या डिप्रेशन में नीचे जाएगा और MI में ऊपर जाएगा, याद रखना. वेरी गुड. ओके. सो इस्कीमिया में डिप्रेशन है और एलिवेशन इज MI. नाउ ट्रीटमेंट इज एंजियोप्लास्टी. व्हाट इज एंजियोप्लास्टी? एंजियोप्लास्टी इज बेसिकली वी विल डू व्हाट? इट इज एंजियोप्लास्टी. ओके, इट इज एंजियोप्लास्टी. Okay, or we can do bypass. CABG is bypass. So you tell me what is preferred. You tell me what will be preferred, angioplasty or bypass. So remember, angioplasty and bypass both can be done. Plasty is the repair and bypass is creating a new vessel. So if you have, let's say, a relationship and the relationship is going bad, so what you should do? We should replace or we should repair. क्या करना चाहिए पहले? आपके फ्रेंड है या कोई गर्लफ्रेंड बॉयफ्रेंड है तो पहले क्या करना चाहिए? रिपेयर इज बेटर और रिप्लेस? व्हाट डू यू थिंक इज बेटर? रिपेयर इज प्लास्टी एंड रिप्लेस इज व्हाट? इज योर बाईपास. क्या करोगे? ऑब्वियसली रिपेयर. लाइक पेरेंट्स, कैन पेरेंट्स रिप्लेस देयर किड? ये लड़का अच्छा नहीं है, चलो नया बच्चा. नो, दे कैन नॉट. So that's why always go for plasty. So plasty is our, yes, angioplasty. So angioplasty, ठीक है? Yeah, Lima is the preferred one for grafting. So yes. Some people always try to replace. क्या बोलते हैं? हाँ. So they give, तेरे जैसे बहुत आते हैं, आती हैं. There are so many. Again, these kind of people are not good people who think people are replaceable. Nobody is replaceable. Okay, all have their special distinct state. Okay. कई बहुत सुपर लेवल के BC MC होते हैं, यू कैन नॉट रिप्लेस देम एट ऑल. ओके, वो बिल्कुल हायर लेवल के, यू कैन नॉट रिप्लेस देम. ठीक है, फाइन. सो दैट कैन नॉट बी रिप्लेस. सम पीपल आर लाइक ABCDZ, सो दे कैन नॉट बी रिप्लेस देम. ओके, चलो. नाउ नेक्स्ट क्वेश्चन. सो व्हाट इज एंजियोप्लास्टी इज बेटर? वी डायलेट द वेसल एंड यू पुट अ बैलून via balloon and put a stent. This is called as angioplasty. Angioplasty. ठीक है. Let me show you angioplasty. This is angioplasty. So what do? You put a guide wire with a balloon, inflate the balloon. As the balloon is inflated, the artery will open. As the artery open, okay. जब artery is open, you put a stent. This stent will keep the vessel open. So stent will keep vessel open. Are you clear? So what the stent will do? Keep the vessel open. Clear now? Now when do you do bypass grafting? It is done in triple vessel disease. So which vessel? Triple vessel, because 3 stent is not advocated. then double vessel with LED involvement, or if the left main coronary artery is affected. In these three conditions, we will go for what? We will go for bypass grafting. Are you clear? And best graft is Lima. Lima is left internal mammillary artery, or we can also use saphenous vein. What are the drugs we use? Drugs we use are aspirin, clopidogrel, low molecular weight heparin. So which heparin? Low molecular weight heparin like enoxaparin. Then we can use a monoclonal antibody called as abexizimab. Abexizimab, which is glycoprotein 2B and 3B blocker. So it block which glycoprotein? 2B, 3B, which promote the clots. So that will become an anti-clotting drug. Anti-clotting. Then we can give beta blocker or CCB because they will decrease the heart rate. So what they do? CCB vasodilation, beta blocker decrease the heart rate. Statins if there's a dyslipidemia. Also lifestyle modifications. Which modification? Lifestyle modification are also advocated. So which modification? Lifestyle modification. Okay, चलो like what वही no so सब बंद कर दो ठीक है चल. So we'll take a 15 minutes break, then I'll continue. ठीक है, then we'll continue. Okay. Let's start. Back. Chalo, let's start. Class till half an hour more. Let's continue, बच्चा लोग. Please start now. We'll start now. Please join in. I am back. Chalo. Today I have a flight to Chennai. I am going there. So we'll meet soon. Chalo. Yeah, Chennai I am going for PG classes. Chalo. Yes, to meet Thalaiva. If he is free, might meet Thalaiva. Otherwise, no problem. Yeah. Only one Thalaiva. Let's continue. So we are doing the last part of the session. We'll finish the cardio and I'll take one more session for the kidney and the GIT that will be there. Okay. So I think it will be second last class. Okay. So let's continue. Now, there's something called as unstable angina, also called as what? Also called as acute coronary syndrome. Now, what do we mean by acute coronary syndrome? Basically, the pain is not relieved even at rest or with nitrates, and the pain is worsening. The worsening is called as crescendo. Crescendo means keep on rising. So it becomes an emergency and it is called as acute coronary syndrome. So if the pain is not relieved at rest, if the pain is not relieved at rest or it's worsening, it is called as our acute coronary syndrome. Okay, it could be MI, it could be MI or unstable angina. It could be MI or unstable angina. Next question, what is the management? मोना. तो याद करना, ये पेशेंट भी मोन कर रहा है, आप इसको मोना दे दो. So moaning patient with pain, give the mona. So what we need to give? We need to give the patient mona. So what we need to give? Mona is to be given to the patient. क्या देंगे इसको? Mona. Next question. Right? What is the diagnosis? It could be MI or could be unstable angina. So what are the two diagnoses? It could be your MI or it could be unstable angina. Okay. Yeah, PYQ will start, don't worry. ठीक है, सब कराएंगे. हरिओम भाई, टेंशन ना लो. Next question. What is MI? MI is basically death of the tissue due to lack of blood. That is called as your MI. Okay. And what necrosis occur? There is coagulative necrosis. So which necrosis? Coagulative necrosis occur in case of MI. So what necrosis? Coagulative necrosis. It releases potassium and biomarkers in the blood, and potassium causes arrhythmia and ECG changes, and biomarker we will use for diagnosis of MI. Are you clear? So that is the main funda. Next question. What is the earliest change in the ECG? This tall T wave. Tall T wave. Then as the T goes up, it brings the ST also. So there is a ST elevation. So what is there? ST elevation is there. This ST elevation is called as what? It is called as our, yes, द पारदीस साइन. तो क्या हो गया? परदेसी ऊपर चला गया, ऊपर, पर ऊपर. सो परदेसी गोes up. परदेसी goes up. And what is the hallmark? T plus ST is tombstone sign. So what is T plus ST? It is tombstone sign. So what is T plus ST? It is our tombstone sign. So tombstone is T plus ST. T plus ST. Fine. So tombstone. Fine. So कैसे याद करेंगे tombstone? T then ST. Tombstone. T then ST. What is the first sign? T sign. Then there is also T wave inversion. So we start seeing what? A inversion of the T wave. And then last change to occur after 24 hours is pathological Q wave. This Q wave persists all life, whereas ST and T become normal after few weeks. So that's why the sign of the old MI. So sign of old MI or infarct is our, yes, pathological Q wave. Now remember, if it's an inferior wall MI, you will see ST elevation in 2, 3 and AVF and depression in AVL and 2. So he'll see ST elevation and this you will see ST depression. Are you clear? So ST depression in AVL1, elevation in 2, 3 AVF. Yes, 2, 3 AVF. Okay. Now what are the biomarkers for MI? First to rise is hard fatty acid binding protein, which increases in 30 minutes. Then we have the myoglobin, which increase after 1 to 3 hours. So myoglobin is 1 to 3 hours. What is myoglobin? 1 to 3 hours. More specific and sensitive, if they ask you, is our troponin T and I. So what is there? Troponin T and troponin I. They are best for MI and reinfarction also. So the best, I is the best. And how many hours? 3 to 8 hours. Okay. Now after 3 to 10 hours, we can even see CKMB and LDH flip. Normal heart 2 is more. In case of MI, 1 is more. So what is more? 1 is more than the 2. So 1 is more than the 2. Okay? Bilkul. So that's why we are not using any other. We are using mainly LDH. Are you clear? Done? Yes. Now new marker is copaptin. Copaptin is an indicator of myocardial infarction. Chalo. If biomarkers are positive, it indicates MI. So biomarker positive, MI is present. So it confirm MI. So biomarker positive, it confirm means MI. Confirm MI. Okay, so write down. So that confirm MI. Now check ECG, check ST changes. So if ST changes are present, it is called as STEMI, that is ST elevated MI. So what is the name? ST elevated MI. So STEMI is ST elevated MI. If it is normal, it is called as non-ST MI. Non-ST MI. Now in non-ST MI, we just give MONA, morphine for pain, oxygen for obviously hypoxia, nitrates, IV nitroprusside to manage the BP and blood flow, and also aspirin we can give 325 to 600 mg chewable form. Okay, yes. but no thrombolysis, streptokinase nahi dena. So that's why only MONA, no thrombolysis. No. So non-STMI, no thrombolysis. So naam mein kya hai? No. Okay. What we can also add antiplatelet drugs like clopidogrel, low molecular weight heparin, beta blocker, CCB. If no relief, if the patient is not having relief, we can do a delayed angioplasty. So what we can do? We can do a delayed angiography. So what we can do? Delayed graphy and plasty. Okay. So delayed PCI, angioplasty. Okay. If it is ST elevated, then we can do thrombolysis if PCI not possible. So that's why it is MONA with S, that is streptokinase or tenecteplase. We can use even tenecteplase. So can do streptokinase thrombolysis or tenecteplase. Tenecteplase. Are you clear? So done now. So that is the whole soul story. Okay. So tenecteplase. So are you clear? So tenecteplase. Chalo. Now what is MONA full form? It's morphine, oxygen, nitrates, aspirin. So फिर से morphine, oxygen, nitrates and A for aspirin. Then comes the treatment of choice. It is PCI. What we do? Early PCI. What we do? Early PCI. If it is possible, like I'll ask you, okay? If PCI is not possible, like within 2 hours, so what is the best time for inserting the balloon? That is 90 minutes up to 120. If not possible, we will inject streptokinase and do thrombolysis. How much time to inject the thrombolysis agent? It is 30 minutes up to 60 minutes. Up to 60 minutes. So let's revise it. First, if ST changes are not there, what is it called as? If normal ST, what is it called as? It is called as NSTEMI. What is the hallmark here? We'll give MONA and delayed PCI. That is angioplasty. Delayed PCI. If it is ST elevated MI, ST elevated. So obviously, if there is a ST elevated MI, then obviously we'll go for MONA and PCI. For the time? Up to 2 hours. Balloon should be inserted. So balloon within 2 hours. Balloon within 2 hours. Okay. Else thrombolysis. Else there should be thrombolysis. Okay. We cannot do both. You cannot give thrombolysis and PCI. If you are giving PCI, no need of thrombolysis. Okay. So L thrombolysis. Okay. With streptokinase. Or we can use tenecteplase. Tenecteplase. Yes, and how much time? Injection 30 to 60 minutes is the needle time. Are you clear? So needle time is this, okay? Yeah, door to balloon is 2 hours and door to needle is 30 to 60 minutes, okay? So 30 to 60 minutes, 30 to 60 minutes is the case. Are you clear? Done. Now I have a question. If you, thrombolysis is yes, TK with PCI. We use this TPA. What is TPA? Tissue plasminogen activator. So what is TPA? Tissue plasminogen activator. Okay. बताया तो है 30 minutes is the best time, but it should be as soon as possible. 5 minutes, 10 minutes, 15 minutes. Upper limit is 60 minutes. After 60 minutes is not useful, so we'll do 30 to 60 minutes. Okay. So remember, I'll ask you a question. Maggie versus biryani. What is better? If someone asks you, I know some people love Maggie, but what is better, biryani or Maggie? Tell me, biryani or Maggie? If you have a chance, what you will go for, biryani or Maggie? Maggie. Okay. See, I agree, but understand. Okay. Let's say there's a marriage. Marriage में biryani खिलाओगे. Now tell me, in a marriage, will you offer Maggie? नहीं ना. बच्चा both दोनों अच्छी. मैंने कब मना किया? मैंने कहा both are good. I'm just giving कि the time decides. Okay. So if there's a marriage, okay, and there's night time, we'll go for biryani. We'll go for biryani. Okay. We'll go for biryani. Okay. But biryani take 2 hours to make. अब समझ में आ गया? 2 hours. Okay. So that means if you have 2 hours, we'll make the biryani. So if possible, we'll go for biryani. That is your streptokinase. Sorry, thrombolysis. ठीक है? PCI. Now, if the time is less, that is biryani cannot be made, okay, there is no utensil, no, then we'll go for Maggi streptokinase, okay. So that's why Maggi if time is not there. सही है. So no time Maggi, if time then it is biryani, okay. चलो ठीक है, fine. So again understood. So Maggi is also very good, biryani is also very good, both are food. I'm just giving the example कि when should we use what, okay. So 90% time if I ask you, people eat Maggi, okay, at especially hostelers survive on Maggi, okay. चलो आगे आगे चलते हैं. चलो, everyone is clear. चलो, now if it's a inferior wall MI, if there's a inferior wall MI, then we give IV fluids, inotropes and more. Don't give nitrates. Don't give nitrate. We can give oxygen, aspirin, morphine for pain, but don't give what, our nitrates, okay. And there is a, yes, inotropes is the drug of choice. Now we'll discuss hypertension. Hypertension is 130/80 is the latest guideline as per Indian guidelines, okay. Hypertension is 140/90. Hypertension is 140/90 and we will give the drugs. So what do we give? We will give the drugs, okay. So drugs are given in this case. What do? Give the drugs, okay. Give the drugs, okay. Now it follow rule of halves. What is the half? Means half the people who are hypertensive are actually tested. Half of them who are tested, they will be given the treatment. Only half of them will take the treatment and half who are taking will take it properly, regularly. So that is why it is very few are actually treated and diagnosed properly. That's why it's called as iceberg phenomena, okay. Primary hypertension is idiopathic, means there is no known reason. It is genetic or environmental factors. So which factors? Genetics or environmental factors. So genetic or environmental factors, okay. And secondary is 5%. It is due to any other disease. So it is due to any other disease. Like most common is renal artery stenosis, glomerular diseases, nephritic, Cushing, Cone, SLE, pheochromocytoma, they all cause secondary, okay. So secondary is due to cause, primary there is no other disease, idiopathic, and most common causes we don't know, okay. Now very few signs symptom of hypertension, that's why it is called as silent killer. Silent features are headache. So if there are constant headaches, okay, sleep disturbances, irritability, malar flush, that is cheeks becoming red, might be hypertension, might be hypertension. Now have you ever thought why Indian dogs bark a lot? Have you thought why Indian dogs bark a lot? Anyone? Why? Anyone? Why Indian dogs bark a lot? Anyone? Yes, we Indians eat so much salt that all our food is salt rich. So when we throw our food, who eat? Indian street dogs, they eat, okay, clear, and that's why they develop hypertension. तो हमारा खाना खा खा के हमारे ये आलतू आवारा कुत्तों को भी हाइपरटेंशन हो गई है, दैट्स व्हाई भौंकते रहते हैं, दे कीप बार्किंग बिकॉज दे आर इरिटेटेड. सो प्लीज डोंट थ्रो और डोंट ईट सच फूड. बट द पेट डॉग्स दे डोंट गेट, व्हाई? बिकॉज दे ईट पेडिग्री. पेडिग्री में सॉल्ट नहीं होता, सही है, तो इसलिए घर के कुत्ते चू 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 करते रहते हैं, दे डोंट बार्क, एंड आउटसाइड स्ट्रीट डॉग्स बार्किंग. अब समझ में आ गया? पेडिग्री खिलाओ और खुद भी खा लो, ठीक है, ताकि तुम्हें भी हाइपरटेंशन ना हो. सो पेडिग्री इज द ट्रीटमेंट, ओके. चलो, ओके, सही है, ओके, गुड समरी, ओके. चलो, अब बच्चे कहेंगे सर क्या बोल रहे हो सर, पेडिग्री खाए हम लोग. भाई खा लो, क्या जाता है कि नहीं? क्लियर? चलो, okay, let's continue. Okay, weight loss is the most effective method. मैं कह रहा हूं ना 90% lifestyle disease are because of weight, and weight gain is because of what? Yes, sitting on the chair. This chair is the enemy of everything. Clear? Whole day sitting in the office doing no physical activity. So that's why diabetes is mostly caused by deficiency of vitamin W. You know that? So what are the most common cause of diabetes? Diabetes is what deficiency? Diabetes. So diabetes किससे होती है? आओ मैं आपको बताता हूं. Diabetes is vitamin W. What is vitamin W? Vitamin W बताओ भाई. What is vitamin W? Anyone? What is vitamin W? Okay. W is walking. Our ancestor village people, they used to walk 5 to 10 kilometer per day. काम तो सभी करते हैं मेरे भाई. तनुज, वर्क तो सभी करते हैं. It is walking. So it is vitamin walking which wife. ओ भाई, वाइफ को खुद डायबिटीज हो जाती है बैठ बैठ के. ये कह रहा वाइफ. ओके. सो वॉकिंग. सो दैट्स वाई 5 to 10 kilometers. 5 to 10 kilometers. 5 to 10 kilometers. ओके. चल सही है. तो इफ यू आर वॉकिंग डेली यू विल नॉट डेवलप डायबिटीज. ओके. सो सिटिंग कॉज डायबिटीज. याद करना, सिटिंग कॉज डायबिटीज. ठीक है. या यस तनुज. यानी शुचू आता प्रावधा. चलो, आर यू क्लियर? लेट्स कम बैक. तो पहले करना है वेट लॉस, फिर करना है डिक्रीज सॉल्ट इन डाइट, ऑल्सो अवॉइड यस एनीथिंग विद लॉट्स ऑफ. या यू कैन सेव द मैसेजेस एंड शो देम ऑल टू अवदेश वाइफ. ओके. यू कैन नॉट शो टू माई वाइफ बिकॉज आई डोंट हैव वन. सो दैट्स व्हाई देयर इज नो थ्रेट about me telling anything. Okay. Yeah, in my offline class I always walk. Okay. Right now though I am also sitting. I get more restless in online class. Chalo. Also stop smoking and alcohol. Stop the smoking and alcohol. ये बड़ी गंदी चीज है. Stop alcohol and smoking. Then come our drug use for hypertension. If it is 140/90 we'll give the drugs. Okay. Drug use if hypertension is 140/90. Okay. Then if age is less than 60 or diabetes, use ACI or ARB. Use ACI or ARB. Most preferred nowadays is valsartan. Valsartan. If not controlled, then we'll add CCB. Add CCB. If still not controlled, add diuretics. A plus C plus D. Okay. A plus C plus D. A plus C plus D. And finally, if more than 60 year, then it is CCB. We add diuretics. If not control, it is ACI. Okay, it is ACI plus CCB. Okay, so let me give a summary. याद कर लो बच्चा. निमोनिक है इसका ACD in young. Diabetics less than 55. If old, बाबा जी old, उनका है CAD. उन्हीं को CAD होता है, उन्हीं का CAD है. तो what is the young person given first? ACE, then CCB, then diuretic. Old person CCB, ACE, diuretics. याद रहेगा. So ACD, CAD, ACD, CAD. Are you clear? So ACD, CAD. So ACD or CAD. Okay. Done. Chalo. If even after 3 drugs the patient is not in control, after what drug? 3 drugs, then तो हमारे पास कोई और ऑप्शन नहीं है. Fine. So then if they are, what we need to do? Then we will give what? What do we need to give? Yes, this is resistant hypertension. What we need to do? Yes, the treatment is we will give what? We will give yes, spironolactone. Spironolactone. Are you clear? So what is the treatment? It is spironolactone is the case. Clear? Chalo, done? Okay, let's come back. If there is more than 180 by 120, it is called as emergency, that is end organ, urgency if no end organ involved. No end organ involved. So if there's no end organ involved, then it is called as, yes, urgency. If it is preeclampsia, the drug of choice is labetalol, which I discussed already. If stroke, nicardipine, clofazimine. If subarachnoid hemorrhage, nimodipine is preferred. If there's a pulmonary edema, the main drugs are loop diuretics. Main drugs are loop and also anti-G. So anti-G loop are used. If systolic dysfunction, we don't use beta blocker, so we'll use CCB. Beta blocker, asmolol is a beta blocker used in emergencies. Okay. If there is myocardial infarction or dissection of aorta, then you will use asmolol. Asmolol plus CCB. ओके, क्योंकि इसका BC हो गया, BC, तो BC में क्या दोगे? BC में देंगे हम बीटा ब्लॉकर, asmolol and CCB. If renal disease, phenaldopam. So renal disease में will give the phenaldopam. So renal disease में phenaldopam and pheochromocytoma, labetalol and phentolamine. We can add nitroprusside. I discussed that in endocrine also. So let's revise. What are the treatment? Remember, if it is what? Preeclampsia, then labetalol. If pheochromocytoma, again labetalol plus our phentolamine IV. If renal diseases with hypertension, phenaldopam. Phenaldopam. Okay, so it is our phenaldopam. Yes. If pulmonary edema, then we will give furosemide, which is loop diuretic plus nitroprusside. And if it is stroke, in stroke we'll give CCB, and can add labetalol. And if it is aortic dissection or MI, B plus C. What is B plus C? Asmolol plus CCB, nicardipine. This will come in the exam. Be ready, solve it 100% sure. Chalo, so I am now finishing the class. Yes, next class we'll do remaining. Chalo. So I'm finishing the class. Thank you very much for joining in. We will all meet very soon. Okay, and keep studying, keep revising. We are going to have very good knowledge of each and every subject, and that is what our whole idea is. Okay, so please don't give up and don't stop studying. Okay, because your study is very, very crucial. Chalo, take care. Good night. I'm going to airport. Okay, chalo, we'll have session after 3 days. We'll meet you soon. Bye bye. Take care. Keep studying. Don't take tension. You are all passing the exam. That is from my side. Bye bye. Take care. Thank you very much, all of you. चलो बाय बाय, टेक केयर, बाय बाय, बाय बाय।